New this morning, a fungal infection has killed 2 Americans seeking cosmetic surgery in Mexico, and more people could be at risk. And new research shows insurance companies are denying more claims, forcing patients like you to foot the bill in the long run. Joining us this morning with an update on today's health topics is our medical correspondent, Dr. Hebert. Good morning. Let's start with the fungal infections. We were talking about this. This is happening from patients going to Mexico to seek cosmetic surgeries. Tell us a little bit more about what is being seen across the country.
Yeah, so basically what is happening here, and I want everybody to really put down your little sandwich that you're eating this morning, because if you want to get cosmetic surgery, or you want to get Botox, or you want to get Juvederm, whatever you want to get, don't go out of the country to a place that is not certified for any type of hygiene specialty, any type of, you can't go to countries that are not part of our medical system and get cosmetic surgery. What is happening is that people are going down to Matamoros, Mexico. Now, that's right outside of Brownsville, Texas. And what happened is that they were getting these cosmetic procedures, and then they got an epidural anesthesia, which is a needle being inserted into your spinal cord, which means you're introducing infection in that point. They got meningitis, and then they died. So what this is that if you go outside of the country, you could be at risk for dying from a procedure that is an elective procedure, okay? So if you went down there, please, you need to go to your doctor, because there are 200 Americans at risk. But I just am saying, in the summertime, people tend to get these types of things done. So I want you to stand back, look at the screen, and recognize that these are the bacteria that could actually cause you to have death from a procedure that is trying to make you look better to yourself, right?
What kind of cosmetic surgeries are these, and who do you think is at risk? I mean, who would you recommend actually going to get checked out and make sure they're okay?
If you got a cosmetic surgery outside of this country,
in
Botox,
Mexico, filler, anything like that?
Anything like that. But this was actually someone getting a facelift, and also someone that could get that got a tummy tuck. So we need to remember that we just shouldn't be going outside of the country to do these types of things.
Okay, now let's talk about rectal cancer in younger people. Is that what you're saying? Talk a little bit about that.
Right. So colorectal cancer, our gut. We talked about this a couple of weeks ago. Our gut is about 80% of our immunity. So we have to keep our guts really balanced. But the increase in colorectal cancer is in people under the age of 45. Below the age, above the age of 45, it's actually going down. But we recognize now that there are a couple of bacteria that could be causing this. Now you say, wow, that doesn't really make sense. The bacteria are causing cancer. But the issue is that, remember the ulcers that people used to get and people still get? That was, we ended up finding out that was being caused by Helicobacter pylori, or H. pylori, right? Which is a bacteria, not just stress. So stress, obesity, processed foods, all these things cause an increase in colon cancer. But there's a bacteria, Fusobacteria and Cladosporidium. Those are bacteria that are found in the guts of some of the people that are getting increases in colon cancer. And that's young people. So I recommend that you please lay off the stress. I know that's hard. Lay off the alcohol, lay off all the processed foods, and then try to get your gut in balance. Go see your physician, because if you eat a bunch of bad stuff, drink a lot of alcohol, your colon will not be in balance. That increases risk of colorectal cancer for you.
And are we seeing this more now than we were before?
Yes, absolutely.
Because of the stress and I guess bad habits?
And younger people. See, we think that because of the younger age, you have more stress right now because of all the stuff that has happened with COVID and everything else. So that's a problem.
All right, we want to talk about insurance claims as well. People are having trouble getting their insurance companies to pay for things that they may once have paid for.
Right, and just quickly, we want you to recognize that your insurance is not going to pay for everything, but a lot of times there are rejection nurses and rejection staff that just decrease your ability to get your things covered, and that is what insurance companies do to try to decrease costs. But if you have a medicine or you have a procedure that you need to get done and it is just totally rejected at the very beginning, please have your doctor call, please have the nurse call, because if you get a peer-to-peer, meaning the doctor to the person that's at the insurance company, a lot of times they will cover it. But in general, there are a lot of denied claims, so just don't let it just linger if you really feel like there's something that you need to get done, because it's happening more and more every day. Get your doctor to call.
All right, awesome. Well, thank you so much for joining us this morning. And Dr. Hebert visits us every Tuesday on the Eyewitness Morning News. If you missed his previous updates, you can get his expert opinion on our app, YouTube page, and our website, WWLTV.com. Let's toss it over to Peyton to get a check of the weather.
All right.